Transobturator Retrourethral Sling for Post-Prostatectomy Urinary Incontinence. Surgical outcomes and patient satisfaction with a minimum of 24 months follow-up. The authors have no conflict of interest related to this presentation. Urinary incontinence is a frequent complication after prostate cancer treatment. Up to 5% of patients will undergo surgical treatment of stress urinary incontinence after radical prostatectomy. Over the past decade, male slings are increasingly used due to a good balance between surgical complexity, cost, and outcomes. Our aim is to evaluate surgical and patient-reported outcomes with a transobturator retrourethral male sling with more than 24 months follow-up. A retrospective observational study in men with predominantly stress urinary incontinence after radical prostatectomy for more than 12 months after surgery, who underwent male sling surgery with the advanced XP device between August 2013 and February 2019. Study variables analyzed, perioperative variables, pad test 24 hours before surgery, daily pad count before and after advanced XP implantation, ICIQ short form questionnaire before and after surgery, surgical time and hospital stay. Complications analyzed were pain, surgical site infection, urine retention, new onset lower urinary tract symptoms, and local hematoma. Patient-reported outcomes were quality of life before and after procedure and satisfaction with the procedure. During the study period, 36 patients fulfilled criteria and underwent advanced XP sling surgery for bothersome stress urinary incontinence after radical prostatectomy. Mean follow-up was close to 45 months. Preoperative continence status, all variables expressed in means. Pad test 234 grams, daily pads 3.1, intraoperative variables, surgical time 64 minutes, hospital stay, it went from 1.4 days for the first 18 patients to 0.5 days. No intraoperative complications occurred. Statistically significant reductions in daily pad use and ICIQ short form questionnaire were obtained. Also, patient perceived quality of life significantly changed before and after surgery. 74.3% of patients gained social continence by using 0 or 1 pad day. 28.6% of them were cured, gaining total continence, defined as no pad use. 25.7% were considered failure by using 2 or more pads one day. Satisfaction with the procedure was high, with a mean of 7.5 in a 0 to 10 scale, with close to 80% of patients would recommend the surgery to a friend or relative. Overall complication rate was 33%. All of them were classified as grade 1 or 2 in the Clavian-Dindo classification system. No patient required further intervention due to complications. Our data show that the transobturator retrourethral male sling is a safe and effective procedure in men with stress urinary incontinence after radical prostatectomy. There is also a tendency to perform it as an outpatient surgery in many cases with reduced cost, postoperative pain, and infections. Nearly 75% of patients are socially continent after the procedure, and severe complications are rare. Male sling surgery improves patient perceived quality of life and provides very favorable outcomes in the mid and long term.